Autism Spectrum Disorders, or ASD, are a group of developmental disorders that affect how a person perceives and interacts with the world. It's important to understand that autism is a spectrum, meaning that it can manifest in a variety of ways, and each individual with autism is unique in their own way. What is autism spectrum disorder? ASD affects communication, behavior, social interactions, and learning. Some individuals may experience difficulties with verbal communication, while others might have trouble interpreting social cues or maintaining eye contact. Many people with autism might have repetitive behaviors or restricted interests, but it's important to remember that these characteristics vary significantly from person to person. ASD is typically diagnosed in early childhood, and while the exact cause is not fully understood, genetics and environmental factors are believed to play a role in its development. Symptoms and signs. The symptoms of autism can be seen early in a child's development. Some common signs include difficulty with social interactions, such as avoiding eye contact or struggling with conversation. Repetitive behaviors, such as hand flapping, rocking, or lining up objects. A strong preference for routines and resistance to changes in daily activities. Hyper or hyposensitivity to sensory stimuli, such as loud sounds or bright lights. It's important to note that every individual with ASD experiences these symptoms differently. Some may show mild traits, while others may have more significant challenges. Types of autism spectrum disorder. While ASD is often referred to as a spectrum, it's also divided into different levels based on the amount of support a person may need. Level 1, mild. These individuals may have social difficulties, but they can function independently with minimal support. Level 2, moderate. People with level 2 autism may need more support with social interactions and behavior, but they can still communicate and engage in daily activities. Level 3, severe. These individuals require significant support for almost all aspects of life, including communication, behavior, and social interaction. Diagnosis and early intervention. Autism can be diagnosed through a comprehensive evaluation by a trained healthcare provider, typically by observing behavior and developmental history. Early diagnosis is crucial as it can lead to early intervention, which has been shown to improve outcomes in children with autism. Therapies such as applied behavior analysis, ABA, speech therapy, and occupational therapy are commonly used to help children develop the skills they need for daily life. Living with autism. Individuals with autism can live fulfilling lives. With the right support, many people with ASD can lead independent lives, form meaningful relationships, and contribute to society in unique and valuable ways. Every person on the spectrum has different strengths, and many have exceptional skills in areas like mathematics, music, or art. Conclusion. Autism is a complex and varied condition, but it's crucial to approach it with understanding and empathy. By providing support, educating ourselves, and promoting acceptance, we can help those with ASD lead empowered lives. It's important to remember that each person with autism has unique abilities and challenges, and with the right support, they can thrive. Thank you for learning more about autism spectrum disorders. Let's continue to build a world where everyone, regardless of where they are on the spectrum, is supported and accepted.